Hi everyone, Dr. Jenkins here, and this is going to be a quick video reviewing the hepatic portal system. So here's what it looks like on a visual diagram, and hopefully you're not making this face when you see it. So let's just do a basic review, hepatic portal system. Let's first remind ourselves, so it's the hepatic portal system. Let's first just remind ourselves what a portal system is. Anytime you see, in terms of vasculature, portal system, it means that there's two capillary beds. Quick review. We know the usual circulatory route. The heart pumps out. Let me redo this here on this side. The heart is going to pump out oxygenated blood, of course. That oxygenated blood travels through arteries, which are colored red because they are carrying blood that's oxygenated. The arteries lead towards a capillary bed, and of course the capillary bed is where exchange takes place. Good things are dropped off to the tissue, oxygen, nutrients, and then waste products are picked up for disposal, CO2, etc. On the other end of the capillary bed are veins, which are going to bring blood back to the heart. This is the normal circulatory route. However, in a portal system, the difference is instead of just being one capillary bed, there are two. So instead of that, let's see what this would look like. In a portal system, same thing, heart's going to pump out oxygen-rich blood. It's going to lead to one capillary bed, but then it's going to travel through a portal vessel to a second capillary bed number 2, which will then go back to the veins and back towards the heart. There's only two places in the body where we have portal systems. You betcha, one is in the liver. That's why we're going to cover this today, hepatic portal system. The other, there's a portal system between the hypothalamus and the pituitary gland in the brain. Okay, now we're going to make this as simple as we can because it could look kind of like this, but we're going to keep it simplified. So, now that we know what a portal system is, let's talk about the hepatic portal system. First, you're going to have to endure some of my bad drawing. So, in the upper left quadrant, of the abdomen, we have the stomach. There's my stomach. The stomach leads into the small intestine, correct? Good. In the upper right quadrant, we have the liver and gallbladder. Excellent. So let's outline our two capillary beds. There's going to be one, more or less, one capillary bed over the stomach and the small intestine. So here's our capillary bed number 1. There is a second capillary bed over the liver. That is capillary bed number 2. So we've just outlined the portal system, correct? 2 capillary beds. The vessel that connects them is called the hepatic portal vein. The hepatic portal vein is what connects the 2 capillary beds. Be careful because we also have a hepatic vein, but that added word, the hepatic portal vein, tells us it's the portal between the 2 capillary beds. This is the basic outline of the hepatic portal system. Last piece here to review would be function. Why on earth do we have this? In this case, we have it for filtration. We have the second capillary bed arrangement for the benefit of filtration. Let's just quickly outline what's going to happen. So, you eat some food. Who doesn't like that? Food's going to travel down our GI tract, through the stomach, and into the small intestine. This is where we absorb. So we're going to absorb nutrients into the bloodstream. That's what absorption means, right? We're going to absorb nutrients through the small intestine wall into the bloodstream. We're going to absorb nutrients through the small intestine wall into the bloodstream. In this case, what bloodstream are we talking about? That first capillary bed. Okay, but here's the added part. We want to filter this nutrient-rich blood first, before we send it back to general circulation. In most instances in the body, we would absorb something into the capillary bed, send it back to the heart, we're done, and then back out to the body. But here, we want to filter this nutrient-rich blood. First of all, there can be bacteria or something in something you ate. Let's face it, we just brought in something from the outside world. Could be bacteria. But also, the liver is going to filter out some nutrients to store for later. If you eat a big meal, we don't need all that glucose that you just absorbed from it in the bloodstream all at once. So here's where we utilize our portal system. So we've absorbed nutrients through the small intestine wall into the blood, into the first capillary bed. But now that nutrient-rich blood is going to travel through the hepatic portal vein into the liver. And this is where we get to filter. We filter out bad things, bacteria, viruses, other things. We filter out glucose to store for later. Filtration. Good. And then lastly, let's just finish the puzzle. Make sure you review what's the vein that leaves the liver and is going to make its way back up towards the heart. We can remember the big vein running down the gut is the inferior vena cava. So now we can finish labeling. After filtration in the second capillary bed, whatever blood is left is going to travel through the hepatic vein. This is not the portal vein, this is the hepatic vein. Drains from the liver to the inferior vena cava, which will then take that blood back to the heart. All right, folks, there you go. Simple review of the hepatic portal system.